Hello. Today we're going to talk about a third type of arthritis, which is psoriatic arthritis. I'm Jennifer Briggs, licensed acupuncturist. Thank you for joining me today. My topic this month is arthritis, different types of arthritis. We've already talked about osteoarthritis, which is kind of common, kind of wear and tear on the joint over time, and the cartilage wears down, and the integrity of the joint starts to kind of fall apart over time. It's a really common thing. And then last week we talked about rheumatoid arthritis, how it's a systemic inflammatory disease that can affect multiple organ systems and really causes system-wide inflammation, and actually deforms the joints and erodes the bone. So today we are going to focus on psoriatic arthritis, and which is a little bit different. It's a little different from, it's related to rheumatoid arthritis more than it is osteoarthritis. And we're going to also talk about how Chinese medicine approaches this type of arthritis. So psoriatic arthritis is an autoimmune condition, just like rheumatoid arthritis, brings about inflammation and a range of symptoms, because the immune system is itself attacking the healthy tissue of your body. It's often associated with psoriasis, which is a skin condition. It causes kind of a rash on the skin and can cause the skin to become red or kind of thickened. It can flake off. Usually it's itchy. Psoriasis often is found on the scalp or on the knees or elbows, but it could come anywhere on the body. So about 15 to 30% of people who suffer from psoriasis will also eventually get psoriatic arthritis. Although there is a small percentage of people who have psoriatic arthritis who don't have any skin symptoms at all. But these conditions are diagnosed through various tests. So various markers in the blood. So it is possible to have the psoriatic arthritis without ever having had a skin outbreak. Conventional treatments for this problem include non-steroidal anti-inflammatories like ibuprofen or Tylenol, corticosteroids, which take down the inflammation, and some immunosuppressive medications. So medications that just suppress the entire immune system. Some combination of those is often, it will alleviate some of the inflammation. These kinds of medications historically can be kind of hard on the body over especially over long periods of time. And sometimes they might not be enough to control all the inflammation, or sometimes people don't tolerate these kinds of medications very well. Personally, I hate corticosteroids. They're very effective, but gosh, the side effects, I just don't feel good when I take them. So this is where acupuncture can really help, because acupuncture actually helps reduce inflammation through the whole body, and also in specific areas that need it, like if there's one particular joint that's affected, or around a skin rash. And taking down the inflammation in the system helps the medications do their work. It also provides an option for people who don't tolerate the medications that are used to treat this disease. So in Chinese medicine, if a person came in with psoriatic arthritis and also suffered from psoriasis, we would have a choice about whether we would focus on the pain or on the skin condition. And really, it boils down to which one bothers the patient more. So if somebody comes in with psoriatic arthritis and an outbreak, if the skin was really the main thing that was bothering them right then, like that's where I would definitely start. But if the joint was bothering more, then that's what we would start focusing on. The pain of the joint pain is very similar to the treatment of osteoarthritis or rheumatoid arthritis in Chinese medicine. Oops, I'm forgetting about my slideshow here. So here's a picture of what that skin condition could kind of look like. You can see, especially on the arm there, that it looks like the skin is real thick and flaky and real dry. You can see where it's kind of a little broken in places. So, if we start, if the joint pain is what's really bothering the person, like the other types of arthritis, the main pathogens tend to be wind and dampness, with either, usually it's more cold or it's more heat. So that we would figure out by the symptoms and by the other just other diagnostic methods that we use, taking the pulse, looking at the tongue. If the psoriasis itself, the skin rash, is the main problem, it's usually linked to an issue with the blood, where there's either too much heat in the blood or the blood quality is poor and the skin is not nourished. So I always recommend that people consult with a doctor before they change their medication. Because some of these immunosuppressant drugs are just really strong and have system-wide effects. I had one patient with psoriatic arthritis who it mostly affected one of their ankles. So over time, the pain in the ankle started affecting the knee because of the way that the ankle joint was moving. So this patient loved getting acupuncture because it took down the pain in the ankle so they could continue walking and doing yoga and other exercises and activities that they like to do. But this knee thing popped up, and they ended up taking a course of physical therapy for it, which I love. I love it when my patients get physical therapy. Acupuncture works really well in conjunction with physical therapy because sometimes the physical therapy can irritate or aggravate pain, but then the acupuncture is there to help calm that down. So this person took a course of PT and it helped both the knee and the ankle. And the acupuncture did a great job of keeping the inflammation levels down through the whole thing. And the physical therapy is really important because the person relearns how to move correctly so that there's not additional stress and on the joints. So that the joints are moving the way they're supposed to, and there's no extra stress. So if you or someone that you know is dealing with psoriatic arthritis, just remember you're not alone on your journey. If you or your doctor has questions about how acupuncture can help with this condition, reach out. You can find us online at briggshealth.com. That's BRIGGSHEALTH.com. And our mission is really to help you find the solution that works best for you, for your health problems. So thank you for being here, for being curious. Have a great day. And again, if you have questions, reach out, post in the chat. I am happy to connect with you however. All right. Have a great day.